Hello everyone, I'm Dr. Timothy Keenan. Today I'd like to show you the best way to heal persistent carpal tunnel syndrome yourself. Place the affected arm on your thigh and put a few drops of hand cream on your skin. Firmly press the round edge of a spice bottle into the middle of the crease of the elbow, then slowly slide it halfway down the forearm and across the painful area. Repeat this 15 times, concentrating your efforts on the most painful region, especially if it reproduces the numbness and tingling in the hand, and adding pressure as the tissues warm up. Do this 3 times a day. These are the wrist flexor muscles. If it hurts yet feels good at the same time, you're doing the right thing. Next, hold the affected wrist with your good hand, bend the hand backwards, firmly press your thumb an inch below the wrist, then slowly slide it across the joint. Repeat this 15 times, concentrating your efforts on the most painful region, especially if it reproduces the numbness and tingling in the hand, and adding pressure as the tissues warm up. Do this 3 times a day. This is the transverse carpal ligament. It's that simple. Try it for a week. If you feel improvement, continue treating yourself at the same intensity until you're perfectly healed. If the pain wakes you up less often and you have more strength in your hand, it's proof that you're healing and you should congratulate yourself. If you treat yourself as I've described, you should be completely healed in 2 to 4 weeks, depending on the severity of your condition. When you start, it's normal to have sensitive skin for 3 to 4 days as your body eliminates stored up toxins. Light bruising may be normal for some people. If you're taking anticoagulants, take more time and use less pressure in order to avoid excessive bruising. If your skin is too dry, add several drops of hand cream. If you're wearing long sleeves, you may want to change the round edge of the spice bottle for the sharper edge of a small can. The most common errors people make with this technique are twisting the wrist when holding the bottle, pushing the bottle with the thumb, rolling instead of sliding the bottle, and sliding the bottle too quickly down the arm, all of which make the treatment ineffective. Never apply heat, including hot baths, since heat increases inflammation. In order to accelerate healing, reduce the intensity of drilling, hammering, sawing, sanding, scrubbing, and wringing cloths. Once healed, if ever you feel the numbness and tingling coming back, treat it immediately before it gets worse. Finally, in an effort to clear up the confusion surrounding the real cause of carpal tunnel syndrome, if you heal yourself using my method, it's scientific proof that your carpal tunnel syndrome was caused exclusively by contracted soft tissues, since that's all my method corrects. This means that even if you can see osteoarthritis, what most people call arthritis, calcium deposits, torn tendons or muscles, bursitis, fibromyalgia, misaligned vertebrae, subluxations, pinched nerves, or degenerated, slipped, thinned, bulging, or herniated discs on your X-rays, CT scans, or MRIs, they have absolutely nothing to do with your pain, so you can ignore them. Only 5% of carpal tunnel syndrome is caused by things other than contracted soft tissues, muscles, ligaments, tendons, and fascia, so you have a 95% chance of healing yourself when you use my method correctly. That's all you need to heal pain yourself. If you have any questions, feel free to write me. Bye for now, and happy healing.